Are you struggling with scratchy throat, stuffy nose? These symptoms might be minor, but they can definitely make you miserable. Upper respiratory infection is very common and very annoying. It does not let you rest. It doesn't kill you, but keep you annoyed. Most commonly, it is due to some kind of a viral infection. Very occasionally, you get bacterial. You could develop cough, sneezing, nasal congestion, sore throat, and fever. Fever is usually mild, it's not very high. If you are running very high grade fever, then there is a possibility that this infection has gotten into your lungs, so you must see the primary care physician quickly. It is transmitted through droplets or airborne. Risk factor to develop upper respiratory infection is when you are in a close proximity of somebody who already have it. We diagnose it clinically, but there are some throat swabs we could do. Very rarely you need any kind of x-rays or anything. Treatment, like any viral infection, is supportive. You need to eat better, keep yourself hydrated, manage your symptoms appropriately. You could prevent it with hand washing, avoiding contact with sick. Potential complications could be sinus infection, bronchitis, and rarely pneumonia. I hope this quick video serves as a guide to help you understand upper respiratory infection. Core message is it is a viral infection, antibiotics are rarely needed. It is self-limiting, it is annoying. If you take all universal precautions to prevent it, you could expect complete resolution very quickly. Thank you.